Hi, this is Mark Besser of Besser Healthcare. In this video, I will discuss hepatitis A and its causes, symptoms, risk factors, diagnosis, and prevention and vaccines, and our recommendation on how and where you can get tested. Either you want to know for sure if you are hepatitis A free, or if you think you have hepatitis A, with fast, affordable, and 100% discreet, private, and confidential testing. What is hepatitis? Hepatitis is an inflammation of the liver that can complicate how well the liver functions. This inflammation can occur due to heavy alcohol use, exposure to certain toxins, some medications, and certain medical conditions, such as viral infections, hepatitis A, B, C, D, and E. What is hepatitis A? Hepatitis A or HAV is a contagious, acute, sudden, and severe at the start of liver disease that, unlike hepatitis B and C, does not become chronic or gradually develops serious, long-term complications. Hepatitis A is a virus, and its infections can be mild and last a few weeks, or severe and last several months. People with hepatitis A are typically cured of the virus without treatment and often only need proper rest and fluid intake. Adults can experience symptoms, including but not limited to fatigue, jaundice, stomach pain, nausea, low appetite. How common is hepatitis A? The most common hepatitis viruses in the U.S. are hepatitis A, B, and C, according to the Centers for Disease Control and Prevention or CDC. Since 1995, rates have declined by more than 95% thanks to the vaccine becoming available. In 2016, there were only an estimated 4,000 hepatitis A cases in the U.S. Most types of hepatitis, especially hepatitis A, are much more common in developing countries. How serious is hepatitis A? Most people with hepatitis A will feel sick for several weeks, but fortunately, it is normal to recover without permanent or lasting liver damage. It is not a disease that commonly becomes a chronic liver disease. However, while it is pretty rare, there have been cases reported where hepatitis A caused liver failure and even death. This happens more often in people beyond the age of 50 and those with other liver conditions. How is hepatitis A transmitted? Hepatitis A can be contracted or spread when an unvaccinated person eats or drinks infected fecal matter through objects, food, or drinks that carry the virus even in microscopic amounts. Eating or drinking contaminated food or water is the most common way of contracting hepatitis A. Hepatitis A can also be transmitted sexually whenever partners' sexual fluids mix with infected fecal matter. The most common way to acquire hepatitis A sexually is through oral anal contact with someone carrying the virus due to the chances of ingesting fecal matter. Symptoms are often mild or not apparent, and a person can transmit the virus to others up to 2 weeks before symptoms even appear. A few other ways of transmitting hepatitis A include close personal contact with infected persons who have poor hygiene, sharing illegal intravenous drugs with an infected person, anal sex. Is hepatitis A contagious? Yes, it is. You are most contagious shortly after you acquire HAV, even if symptoms haven't appeared yet. Once symptoms do begin to appear, after 2 weeks, you are no longer contagious. However, those with weak immune systems may be contagious for up to 6 months. Can I get hepatitis A again? No, if you have been infected with hepatitis A in the past, your body has developed antibodies to the hepatitis A virus, therefore, you cannot get it again. Risk factors of hepatitis A. According to the Centers for Disease Control and Prevention or CDC, hepatitis A transmission is decreasing in the United States. Getting tested is especially important if you have traveled or lived in Eastern Europe, Africa, Mexico, Central or South America, or certain parts of Asia where hepatitis A is prevalent. Those at a higher risk of acquiring HAV may include those who live in areas that have a lack of safe water, live in a household with an infected person, have poor sanitation or hygiene, are sexually active but are not vaccinated, participate in anal sex or oral anal contact, travel to areas of high endemicity without being vaccinated, work with non-human primates. Prevention and vaccines for hepatitis A. The best method for preventing hepatitis A is to get vaccinated, as it is highly effective at preventing infection and providing long-term protection. The CDC recommends getting a shot of immune globulin or IG before traveling, or if you are at a high risk of contracting the virus. Hepatitis vaccines are considered highly effective and safe. The following people are recommended a hepatitis A vaccination: all children when they reach 1 year old, travelers to countries where hepatitis A is prevalent, family or caregivers of adoptees from countries where hepatitis A is common, those who participate in oral-anal sex, users of recreational drugs, whether injected or not, people who live in unsanitary conditions or experiencing homelessness, people with chronic or long-term liver disease, including HBV or HCV, people with clotting factor disorders, people with direct contact with others who have hepatitis A, any person wishing to obtain immunity against the virus. What is post-exposure prophylaxis or PEP? In the case of hepatitis A, PEP works as an injection of either the hepatitis A vaccine or immune globulin. Post-exposure prophylaxis means to attempt at blocking or treating a disease after exposure. If you have ever been exposed to someone or went through a scenario with a high risk factor of acquiring hepatitis A, PEP is an option at your disposal. However, PEP is only effective in preventing hepatitis A if given within the first 2 weeks after exposure. Other ways to avoid hepatitis A: thoroughly washing your hands with soap and hot water after coming into contact with fecal matter is key to avoiding the hepatitis A virus. The good news is, once you have had the hepatitis A virus, you cannot get it again since your body has built up antibodies against it. And now, onto our recommended hepatitis A and other STDs screening company. Click the website link listed in the description below this video to see the list of their test centers in your area with the discount coupon. Or go to bessercare.com/STDcheck. Our recommended hepatitis A and other STDs screening company makes getting tested for STDs a simple and convenient process in just 3 steps. Step 1. Order their STD-10 test panel or individual tests online or by phone. Step 2. Choose one of their 4,500 test centers nationwide. Testing only takes minutes. Step 3. Your test results are delivered in your online account within 1 to 2 days. The entire process is fast, affordable, and 100% discreet, private, and confidential. Remember, either you want to know for sure if you are hepatitis A free, or if you think you have hepatitis A, you need to get tested as soon as possible. Don't delay. Thanks for watching this video. If you like this video or find value from it, please click the like button and let us know what you think in the comments section below. Or if you have further questions or want to share something with us in private, please feel free to reach out to us at mark@besserhealthcare.com. And if you want us to include a certain topic in our next videos, please let us know in the comments section below or email us. Also, subscribe to our channel and click that bell for you to be notified of our upcoming videos. See you again in our next videos. Stay safe and healthy, everyone.